So we've got Chris and Jon on the line, who are from our partner company called CarePoint, and we work on a similar program of work with them in the Netherlands, where they have something called the PGO model that supports a program of work called MedMij, and that is similar to what they're trying to do with the NHS App, except it's not a subset of data, it's actually all data. And we've been working with CarePoint for a number of years now to get accredited as a supplier, so that individuals that use PKB in the Netherlands can click on a magic button and their data appears within their record, which I kind of wish we had here in the UK, to be honest. It would make things a lot simpler if we had that model. Chris and Jon, I don't know if you guys want to actually say anything briefly before we move on to the next speakers, because this is a lot of your hard work that has gone into this over the last few years. So if you did want to talk about the Dutch model in any way, we'd be delighted if you wanted to, but no pressure if you don't.
Thanks, Sally. And I'm impressed to share this meeting. Sorry for my closing, but I'm on my holiday on Tenerife. And it's here 29 degrees centigrade. So I'm drinking a lot of water. And sometimes you see one of my grandchildren running around here. But okay. The difference in approach is maybe important to tell about. In the Netherlands, our Ministry of Health has chosen for giving the steering wheel for the medical records completely in hands of the patients. So the initiative to collect medical data is always at the patient's side. It's forbidden even here that a hospital or a GP sends automatically medical data to a certain client. That has to do with the ideas about safety, privacy, etc. That's one. Secondly, we give a big role here to our National Dutch Patient Federation. And that has to do with what we call a paradigm shift to move into the direction of the patients. And that was the basic idea where Mohammed has taken the initiative more than 10 years ago. And now our Dutch ministry is also convinced that that is the best way to go ahead into the future. The third issue maybe to mention is that we learn that there's a lot of similarity between your experiences in the UK and our experience in our small country at the other side of the North Sea. And of course, we talk about a lot about Brexit, but there's a lot to share also in the future. So we are very happy to cooperate with the team of PKB in the UK. We learned a lot about it, and sometimes we have the idea that our colleagues in the UK learn a little bit from us. That's more or less the balance we continue with looking. And you know, the smaller the country, the biggest mouth the people have. And that's also in our situation the case. We are now introducing PKB rather heavily because all the 4,500 GP practices in the Netherlands are now connected to a system which is called MedMij, but to a certain extent, it's comparable with your NHS. So every Dutch citizen using a personal health record like PKB can collect the medical data from the GP and also send the GP own inputted data, like Fran just told. It was, by the way, Fran, an impressive presentation. My compliments for you. So there's a lot of similarity, but also some difference. And that is why we work together and we learn from each other. And I can congratulate you that you have a team like the PKB team in the UK. And I'm sure they will be successful and we learn from each other. Thank you, Sally.
Thank you. And I know I put you on the spot then, so we really appreciate you giving us an answer.